erectile dysfunction. Erectile dysfunction, I will tell you about the causes, symptoms, and the treatment of erectile dysfunction. Erectile dysfunction is a condition which affects the millions of men worldwide. It is the inability to maintain the erection. It is spreading throughout the world and understanding its causes and recognizing its symptoms and exploring its treatment are the crucial for the management of this condition. So first of all, we will move towards the causes of erectile dysfunction. Number one cause of erectile dysfunction is the physical factors. Some physical factors just like blood pressure and the cholesterol level that are the main causes of erectile dysfunction. There are hormonal imbalancing and include to pelvic disorders and the prostate surgeries and the neurological disorders are the main factors that cause the erectile dysfunction. Number two, psychological factors. Stress, anxiety, depressions, and the relationship issues are the factors that causes the erectile dysfunction. Physiological factors often exacerbate the physical causes, creating a vicious cycle of erectile dysfunction. Further, we will move toward the lifestyle changes. Lifestyle changes such as smoking, excessive alcohol consumption, and drug abuse and sedentary lifestyles are the main factors that cause erectile dysfunction. Then, on number 4, there is a medication that causes erectile dysfunction. So, certain medications include antidepressants and antihypertensives, and the prostate cancer treatment drugs are the main drugs that cause the erectile dysfunction. Now, on number 5, we will move toward the aging. Aging is a factor that will cause the erectile dysfunction, and aging will reduce the testosterone level of the man, so it causes erectile dysfunction. Then we will move toward the symptoms. We can get that we have the erectile dysfunction through our symptoms. There are some major type of symptoms on erectile dysfunctions are this: difficult achieving an erection, the inability to get or maintain an erection from enough for sexual activity is the primary symptom of erectile dysfunction. Reduced sexual desires. Some men with erectile dysfunction may experience a decreased level of interest in sex, and there is a decrease in libido as well. Due to the performance anxiety or frustrations, these symptoms may develop in erectile dysfunction. Premature ejaculation or delayed ejaculation is the main symptoms of erectile dysfunction. Erectile dysfunctions can sometimes coexist with ejaculation disorders, leading to further sexual frustration. Second number is emotional distress. Feeling of embarrassment or frustration related to sexual performances can affect men's self-esteem and mental well-being. So, I will tell you about the treatment of erectile dysfunctions. Some women are facing these problems because their men aren't performing well on the bed, and a lot of men are facing a lot of problems in this field. So I will tell you about the treatment. Lifestyle changes according to a healthier life. We can improve an erectile dysfunction. It includes quitting smoking, limiting alcohol consumption, maintaining a healthy weight, and exercising regularly to improve cardiovascular and health and blood circulation. So we will perform well on the bed and we can maintain our erectile dysfunction disorders. Medications that we can take in erectile dysfunction are the sildenafil tablets, which is come in the brand of Viagra, tadalafil in the brand of Cialis and vardenafil. Levitra is the brand of vardenafil, are commonly prescribed erectile dysfunction tablets. These drugs work by increasing blood flow to the penis and facilitating erection when sexually aroused. There are some therapies that we can perform in erectile dysfunction. Counseling therapies or therapy sessions can help addressing underlying physiological issues and contributing to erectile dysfunction, such as anxiety or depressions. Couple therapies may also be beneficial in resolving relationship conflict to sexual dysfunction. Further, we will move toward the hormonal therapy. For men with hormonal therapy, or hormonal imbalancing contributed to erectile dysfunction. Hormonal replacement therapy is the main thing we can do to avoid the erectile dysfunction. Further, there is a vacuum devices and penile implants are the treatments or the therapies which we can perform to get rid of erectile dysfunction. Alternative therapies may include acupuncture, herbal supplements, and lifestyle approaches such as pelvic floor exercises. Like Kegel exercise is the most important exercise in erectile dysfunction. May offer additional benefit for some men with erectile dysfunction, although more research is needed to confirm their effectiveness. In conclusion, erectile dysfunction can have a significant impact on a man's daily life and intimate a bad relationship. By understanding the causes, recognizing symptoms, and exploring various treatment options, men can affect their lives so badly because of erectile dysfunction. It's essential to consult with a healthcare professional to determine the most appropriate treatment approach based on individual needs and medical history. Stay happy, stay healthy, see you soon. Subscribe this channel for more videos and for more health tips. Thank you.